Welcome back. Few things are as important in life as your health. Microsoft founder Bill Gates wants to have a say in how our government prioritizes your well-being. He spoke today at a meeting for the National Institutes of Health. If the name sounds familiar, it's because Dr. Fauci runs the infectious disease programs at that agency. Back to Gates. He donates to the agency the tune of hundreds of millions of dollars. So he'll have a big say in what they focus on for the years to come. The question is, why does he do this? Some allege Gates is hell-bent on depopulating the world with vaccines. No, seriously, that's what they argue. Others will tell you he's just a rich man trying to make the world a better place through science. After all, he's donated more than $80 billion to charity since 2000. Most of the money is used to combat malaria, HIV, and AIDS. He's also creating more new nuclear energy program called TerraPower. Investigative journalist Jordan Schachtel previewed Gates' speech, writing, Bill Gates will join Fauci this week to dictate U.S. government health priorities for the future. Jordan is with us now. How much of this is conspiracy theory, Bill Gates controls everything, and how much of this is a very wealthy guy, donates a lot of money, it's worth hearing him out?
Well, whether you want to hear him out or not, Bill Gates has a gigantic microphone. He has successfully used his money to infiltrate every aspect of U.S. government health, whether that's statistical modeling through his institute in Washington State that Birx and Fauci were using early on to model the pandemic, or his pre-equity investment in BioNTech, which partnered with Pfizer to make the mRNA vaccines, or this week, where he's at the NIH funneling hundreds of millions of dollars through the NIH in order to influence them about the policy measures that he thinks are appropriate for the U.S. government. So Bill Gates has been doing this for a very long time. I think he's gotten onto people's radars more recently because of the pandemic, but Bill Gates has been
to be fair to Gates, back in 2015, he all but predicted COVID. Take a listen.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
Is there any evidence that Gates is doing this at the detriment to the health of Americans?
Well, I think his approach is detrimental to the health of Americans. He's using this collectivist, technocratic approach to healthcare, and it's basically whatever Bill Gates says goes, because he's the one that's financing all the projects. He's the one who put all the scientists in place, who are all a bunch of yes men. So that's kind of the issue with healthcare, or at least health policy, public health policy in the United States is entirely dictated by institutions that are controlled by Bill Gates through his money. And I think more people should understand this. The idea that we should have one guy who's not even a medical doctor, whose experience comes from the tech world, who sees everything kind of like as a software update problem, that he's been running the show for quite some time. And it's not just me who's saying this. I mean, Politico's done some great investigative work on Bill Gates's control of the U.S. Public health institutions. And again, he's been at this game for a very long time. And now he's kind of come into the spotlight, and he's really trying to force his agenda down our throats. And I think people are right to stand up to him and say, you're not an elected official. You're not a medical expert. Why do you think you have the right, through your supposed philanthropic efforts, to tell us what to do?
What program has he funded that you have a specific issue with in terms that it's hurt people more than help? We can disagree on tactics, but where you really view the spirit and the idea behind it is misguided.
Yeah, so early on in the pandemic, Bill Gates' institution, the Institute for Health Metrics and Evaluation, played an enormous role in dictating the U.S. responses with the pandemic. They were modeling the COVID-19 spread and telling states. Deborah Birx, the former coronavirus task force chair in the Trump administration, was using that information through her Gates network to essentially tell states what to do, because they thought that there was going to be spikes soon. So from a very early time, the Gates network was really dictating policy through intermediaries in both government and the private sector.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.